I would like to welcome ACS members to the American College of Surgeons Engaging the Resident Member Series. I'm Madhuri Nagaraj, a surgeon at UT Southwestern and member of the Education Committee of the Resident and Associate Society. The Resident and Associate Society has developed this interview series to spotlight engagement activities from ACS chapters. The goal of the interview is to help promote activities that chapters have developed and share them between chapters of all sizes and geographic locations. Let's begin the interview. Joining me today is Dr. Reddy from the Fox Chase Cancer Center in Philadelphia. Let's start by having you tell us a little bit about yourself to include your work history and your current role.
Thanks for having me. So my name is Sanjay Reddy. I'm a surgical oncologist at the Fox Chase Cancer Center.
Thank you for joining us today. I'm tasked to talk about the mock orals that each of our ACS resident chapters host. So just to start, would you like to briefly describe how the chapter prepares for and arranges mock orals?
Sure. So I'll tell you a little bit about the Metro Philly chapter itself. We have about 1,300 ACS members. These include active fellows, associate fellows, senior fellows, retired residents, and medical students. So it's a pretty robust organization. The mock orals this year have undergone a little bit of a different spin with COVID, and the virtual platform was something new to us, which we've fully embraced. And when we were thinking about doing this, we wanted to continue doing this because we've been doing this now for over 8 years. And so historically, it's been organized by two co-chairs, myself and Dr. Tholey. And for the past few years, we overtook the initiative to revamp it a little bit. The first step is really organizing the roster, figuring out how do you pair the residents with the attendings. We reach out directly via email to the program directors, asking first if there's interest within the institution to participate. We've historically offered this to PGY4s and PGY5s. And then if there's over extra room, we'll offer it to some fellows as well for the practice. We then ask the faculty or the PD to help organize the faculty to see who may be interested in participating. And the goal is to have a 1-to-1 ratio. So 1 resident to 1 attending, so that when we do the formation of the grid, we have a grid of examiners and examinees, and no one interview with an examiner will be from their home institution. So that way you get a little bit of that nervous feeling of not knowing the other person on the other side of the nowadays screen.
My next question focuses on how your mock orals are publicized to your trainees, which you touched on, but also specifically what years and what programs you reach out to. And if you notice that there are certain programs that participate a little more frequently, and in overall, how many generally participate each year?
Yeah, so this year we had about 61 examiners and examinees take part. We had 10 institutions take part this year in our first virtual session. Historically, it's been about that similar amount of institutions and also examiners and examinees. What we've noticed, I think this year in particular with the virtual concept, is that it's allowed us to branch out a little bit more. We probably do have the capabilities of offering it to more institutions within the general area. And I think our ultimate goal will be to do so.
The next question I had is on the flip end. How do you decide who are the faculty or the moderators that are recruited? How do you differentiate amongst which specialties? And again, how many generally participate?
The tough part sometimes is there are a lot of overlapping fields, right? So there may be one year where there's a lot of general surgeons or colorectal surgeons that are participating and that are involved. In other years, there may not be as many. What we then do is we then email the examiners and ask them to list specific certain areas, at least 3. We were able to do this via a survey platform this year. So it was more organized and electronic. And they'll list 3 areas they feel comfortable in. And then we'll use that to kind of help match the rooms up.
Dr. Reddy, you had mentioned that you take what the faculty or the examiner is comfortable with and you put them into a room with similar interests. Of that, the next question that I had for you is, of the faculty, how many would you say actually have previous experience giving the true oral board examination or previous experience with mock oral examinations, whether in your chapter or another?
That's a good question. I think a handful of people have had experience with the actual oral boards. Most of the current examiners are repeaters. They do it once and they keep doing it again. Every year, I think we may end up recruiting maybe 2 or 3 new faculty members.
Does it seem that a lot of the faculty who keep coming back into performing these mock orals with you guys are often involved in the residency education system, apart from just the program directors? Are they fellows that have had previous experience or APDs, or do you reach outward into other faculty?
You know, I really think that anybody in this day and age that's in a residency training program, training residents, is vested in residency education and training. So it's not specifically just program directors or APDs that are involved. It's really the core faculty. I mean, and generally core faculty of a residency program are people that, again, have vested interests. So for the most part, everybody that's participating is interested in resident education.
We're going to change gears a little bit now, and I wanted to talk a bit more about how you structure your mock orals days. So can you give us a brief overline of the general structure of the way that the day looks? For example, how long the entire mock oral session takes? What is the time frame of the day that you guys do this in? How many scenarios you offer to the trainees? And how often are you giving these mock oral sessions as well?
Okay, so to start, the mock orals are offered once a year. The day typically starts around 8:30 for the examiners. And orientation is usually held from 8:30 till about 9. And then the first session actually begins from 9 to about 10:30 a.m. The second session then takes place from about 10:30 to noon. And the overall structure has been about 2 examiners in every room. And again, this year it was virtual. So via the Zoom, we were able to place 2 examiners in a room and then shift people back and forth. And they were kind of, again, virtual rooms. There's average of 4 scenarios given over a 15-minute period. This year, again, virtually, we had a 2-minute warning, which was like a message across the top of the screen. A year ago, it was a knock on the door that would, facilitate getting things moving. This year, what would happen is at the 2-minute warning mark, when it was finished, they were automatically kind of bumped out of the room into a waiting room before they got reassigned to their next room. So on the virtual platform, the examiners stayed in their rooms together and the examinees got pulled in. In the live version, at the 2-minute warning, you'd have a little bit of time to wrap up. They would get pulled out of the room. They would wait for the next room. We would jot down notes and comments, and then we would go to the next session. Historically, we've held these examinations in the fall, typically September, and it's usually on a Saturday. The in-person sessions were held at one of the local facilities, Lincoln Medical Center. And again, the virtual one was a little bit shorter. The in-person one average runs from 7 a.m. to 1 p.m. And again, we have about 30 to 36 what we call breakout rooms, where there's 2 examiners in every room. And again, we focus on all aspects of general surgery and all the surgical subspecialties. We have not in the past set specific scenarios for examiners to present. And this year, based on our recent survey results, that's something that we're going to consider doing for the MPACS chapter moving forward. Because I do think it's nice if you have specific scenarios so everyone is kind of benchmarked on a scenario, as opposed to having a lot of, mixed questions and not a lot of, maybe having too much variety in questions.
So maintaining the consistency with the questions that are asked across the board.
Right.
Okay. And that, again, leads into my next question. So when you are done with your mock oral session, in what way do you guys provide feedback to the trainees? And what type of feedback, in the sense, is it given verbally in person? Do you give it in writing? And how often?
Yeah, this is probably one of the most important parts of the mock oral task here, is providing feedback, right? Because this situation would mean very little if we didn't provide feedback for the residents to really understand where they could get some practice and work on things they need to work on. So what we do is the examiners will actually record their comments in a Word document. And this is given eventually to the co-chairs, who then collate everything, and all comments are given to the examiners in a summary sheet. The scoring system is pretty simple. It's scored on a 1 to 3 scale. And it's pretty much clear pass, indeterminate grade, clear fail. And then there's a 0.5 system. So a 0.5 would be, 1.5, or sorry, 1, 1.5, 2, 2.5, and 3. And then what we do is we then will average the score, and then that'll be your score. And then we will then determine what the median is across the board at the end of the session. And then we determine what the average is. And then a fail is below the average and a pass is above the average.
And correct me if I'm wrong, you do that so that people know their grade in relation to the entire cohort that performed during that mock orals?
Correct. It's irrespective of institution, level of training. This is just a summary of, against the people that participated, the average score was X and you scored above it or below it. The examiners do take a good amount of time writing comments. And for the purposes of this, it's not just content. I mean, content's a huge part, don't get me wrong, but it's also simple things like, are you making eye contact? Are you fidgety? Or are you, you look nervous? I mean, those are kinds of subtle cues that during the oral boards does carry some weight. And I think that it's important to really recognize that at the time of this practice session.
Exactly, non-content based feedback. I don't know if you have this information, but do you recall maybe the types of scenarios that trainees do particularly well on and types of scenarios that trainees tend to struggle with?
Yeah, it's an interesting question. I've been doing this now again since 2012, and being on both sides of the table, what I've noticed that, listen, some institutions are very strong in certain areas, right? They do a lot of trauma, they do a lot of thoracic, they do a lot of colorectal. Institutions will tend to do better in areas that they have more experience or exposure in. What that would also tells you is that it's a good guide for the program to say, hey, listen, maybe we need to work on trauma and get more exposure to it. So I don't think it's necessarily just helpful for the examinees, but also for the program directors, for them to realize kind of where their residents potentially are lacking in education and figuring out ways to help boost that.
And as you said, that formative feedback is really important. Is that feedback then provided to the program directors as well who recruited the trainees who participated?
Well, the program directors are the ones that actually will get all the sheets and summary sheets, so they will look through it and then they distribute it to the residents. So I suspect they are able to see where they went wrong or where they need to do some more work on.
How do you feel that your mock orals prepares trainees for the oral boards? Is there anything you feel you do particularly well and anything you think you would like to change about your structure?
And we found that examinees had an 87% first time success rate of passage on the American Board of Surgery certifying exam versus 76% for all examinees from the same cohort that included training programs. So this showed that if you did well on this, it did correlate with passage. And again, I think a lot of it is good board prep, right? It's not about necessarily content, it's about feeling comfortable. Again, virtually is a completely different story and ballgame, but when we were doing it in person, just sitting in a room with somebody you don't know makes you nervous, right? And that alone prepares a candidate for what to expect on the actual boards. And the more you can do that, the better off it's going to be. Now, with that being said, the content is also very important, and being able to articulate what you want to say, answer the questions appropriately. And when I prepared for the oral board, I just remembered it's all about the rhythm, right? You get asked a question and you got to go through the history, the physical, you don't want to skip steps. So it's learning that process and doing it over and over again in stressful situations is what ends up being very important for preparation for the boards.
So clearly you guys have published on how those outcomes actually translate to the oral boards. So in general, what advice would you give to other chapters who are trying to formally set up mock orals, whether they've done it in the past and are trying to restructure or they are entirely new to this?
Yeah, so I think one of the most important things to understand is your structure locally, right? What local institutions are available both trainees and also examiners that are potentially going to participate. So understanding that geographic landscape is really important. Reaching out to the program director as a single point of contact is probably the most important and beneficial thing we can do. It becomes hard to constantly contact individual people. So the other thing that I can say is that setting deadlines is important. And then the other thing that I found to be very important and helpful is save the dates, reminder emails.
Now, on a similar note, you've brought this up a few times, but clearly there was a large transition to the virtual platform with the way that you held your mock orals this year. Do you have any particular advice or just lessons learned from how the virtual platform maybe helped and hindered your implementation of your mock orals, and whether you feel you're going to continue using that ongoing in the future?
Yeah, that was actually, we just had a meeting and we were discussing the exact topic. I think that the virtual platform lends itself to many new avenues and opportunities. We can expand more. We can recruit farther out. We can recruit different specialties. We can recruit more people to participate in terms of examinees. I think there's definitely a space for the virtual platform here, but the things that I miss is, and this is how life has been for the past year, is the collegiality and kind of sitting in a room with somebody and just talking, right? One of the biggest things that I found helpful with the mock orals is networking, right? Not just me networking with other colleagues in the city, but also the examinees networking with other attendings across the institutions, right? It's a real neat way to really understand and just meet other people. So I think that the virtual platform will continue. My hope would be that we would have maybe 2 sessions a year, maybe one virtual platform session that's on a much broader, grander scale, and then a local one that's an in-person one. But again, time will tell when we'll get to that point. But I think for right now, we're pretty set on doing this again in a virtual platform because it did work well and it was smooth, and perhaps inviting more institutions to participate if they're interested.
The last question I have for you, I've obviously structured and asked you many questions, but overall, do you have any other thoughts that you would like to share about how you guys arrange your mock orals and how you feel that you might be able to contribute to other chapters as well?
Well, I'm more than happy, myself and Dr. Tholey, to offer advice. If a chapter is interested in doing this, needs some guidance or help, it's really a team. Myself, Dr. Tholey, Robbie, our program coordinator, were, a tremendous part in this. If you don't have a good program coordinator, this will not work. You have to have that structure. And it's really a matter of the team really kind of working. And again, emailing. I mean, sometimes it's hard. Everyone's busy surgeons in the city, and it's hard to get them to commit and spend a Saturday with us doing this. But people recognize the importance of it and how helpful it's been for the examinees. So I think that if anyone's interested in doing this, there will be plenty of people, more surprisingly than you think, that'll want to help and participate.
Well, thank you so much for that. It's very clear that you guys have put an immense amount of work into your Philadelphia chapter, let alone how you guys feel and work amongst each other, but the fact that you're able to recruit people year in year who stay and continue to educate us. So we're extremely grateful for not only your ACS chapter mock orals, but sitting with us to help us maybe expand this across to other chapters as well. Thank you so much.
Thank you for having us. And again, on behalf of the MPACS chapter, really it was an honor for you to ask us to talk about our experience. We really do hold this as an important part of our chapter history, and anything that we can do to help, please feel free to reach out.
Thank you so much.